okay, policy, the environment that they're in, the socioeconomic status. And when you're having conversations with individuals and trying to empower them or to get them to do the things that you want to do, you got to think about the person and where they come from to try to help resonate with them and to get to those behavior changes. So that's another thing to kind of think about, and I think a lot about that. And then the last slide, and I promise I'll go away. So I am a proud to say, first generation immigrant, son of an immigrant Italian. My dad immigrated here when he was 27, couldn't speak any English, was a barber, a landscaper, and a baker at night.
Wow.
We were poor, really, really poor. First to go to college, and I just stayed there, more for spite. And anybody knows an Italian, my parents, they said, I wasn't a good high school student, and they said, well, you're gonna fail out, and then you're gonna work in your dad's barbershop. And I was like, oh, watch this. So I think the first 8 years of school was just spite. That's all it was. It wasn't really a professional role. It was just, I'll show you. But getting to know my dad or thinking about my dad, he owned his first shop in Mileto, Italy. And I started to think about my dad could get anybody to do anything when someone was in his chair. And he would have been a great healthcare professional, I think, with a little bit of training to be a counselor with respect to health. And so I thought a lot about, and I put in this paper, I wrote a paper about my dad and the things that the things that his value system, and I think it does kind of resonate with what we want you to be as clinicians. So I'm not going to read through that, but there's a paper on this, but really try to resonate with people, really try to listen to them, to understand them, no matter who you are. When you go into a room to treat someone or care for someone, you got to kind of leave your value system at the door and really try to resonate with someone, no matter who they are, when you're in that room. So kind of try to think about that as you go out there. And that's kind of all I have. We'll see. Maybe you can give some feedback to Rich, like he should just go back to introducing the next speaker and get off the stage. Or if you liked it, maybe I'll continue on. But so nice to have you all here, family. Enjoy the ceremony. And with that, I'm going to introduce your next speaker. There was a title for this. Oh, the faculty speech by Dr. Alyssa Jones. Thank you.
Okay, hello, good afternoon, everyone, and welcome. We are so happy for you all to be sharing in this special moment with us. For those of you who don't know me, I am Alyssa Jones. I am a clinical assistant professor in neurologic physical therapy here at UIC. And when I found out that I had been selected by this class to give the faculty speech, I was beyond touched, and it truly is an honor to be standing here today. Being chosen by the very students I've had the privilege of teaching with and learning alongside makes this moment incredibly meaningful. Today, we're here to recognize something truly special, the resilience it takes to get to this moment, the growth you've all undergone, and the community that believes in you every step of the way. Behind every white coat, today stands a circle of support. Family, friends, partners, and loved ones. Thank you. Thank you for the sacrifices you've made along the way. The time, the energy, and understanding you've provided. Whether it was adjusting weekend plans, quizzing our students on obscure anatomical landmarks, or simply being a steady presence through the chaos. Your support helped make this moment possible. And thank you for your patience. If you came to them seeking advice on your aches, pains, and mysterious creaks, saying things like, my shoulder really hurts when I move it like this, and getting that highly educated and very clinical response of, well, then don't do that then. Joking aside, this class is incredibly special to me. Not just because of your accomplishments, but because of the journey we have shared. You are the first cohort I had the opportunity to teach from start to finish after transitioning from clinical practice into academia. And together, we made mistakes, we found our, that's a lie. We found our confidence and we grew. Whew. You truly embraced me, affirming that it was exactly where I was meant to be. Okay, I can do it. Okay. You were patient as I navigated technological hiccups, whether it was getting the sound system to cooperate, or sitting through a few too many YouTube ads just to get through this show. Like showing how when someone with Parkinson's disease, struggling to walk in their own home, can suddenly glide effortlessly across the room when their PT adds a little music to group too. I watched you go from nervous first years, sweating your way through your first practical, and taking some simple blood pressure and range of motion measurements, to confidently treating individuals recovering from stroke and spinal cord injuries with evidence-based practice, strong clinical reasoning, and most importantly, compassionate care. Over the past 2 years, you've poured yourselves into this. You endured the late nights, navigated group projects, pushed through the high-stakes exams, and you faced practicals that not only tested your knowledge, but your confidence. And you didn't just survive, you all thrived. You showed up again and again, not just for yourselves, but for each other and the patients you're preparing to serve. And I don't know if you fully realize this, but you've already made an impact. We've heard it from your clinical instructors on your ICE visits, how impressed they are by your level of preparation, your sharp critical thinking, and your clear communication. They've seen what we've all known along. You are ready for this next step. What makes this moment especially meaningful to me is that I once sat exactly where you're sitting today. I am a proud graduate of UIC's CPT program, and upon my return, I was reminded of just how truly special this place is. UIC didn't just shape my career, it shaped who I am. And now I have the joy of witnessing it shape you too. It's a place that faculty are not only experts in cardiopulmonary physical therapy, orthopedics, pediatrics, sports, and of course neurology, but also active researchers, innovators, and leaders in our state and national associations. It's a place where our support staff go above and beyond to make it possible for faculty to teach and mentor our students, who in turn feel seen and empowered. It's our clinical partners here at UI Health across the state and nationwide, who provide mentors who are willing to invest in your growth, challenge you, and shape you. I've been told time and time again that they seek out UIC students, not only for your clinical expertise, but for your work ethic, humility, and your willingness to dive right in. And of course, there's you, our students. You come from all over with different backgrounds, life stories, and aspirations. But what unites you is your dedication, curiosity, resilience, and deep sense of kindness. Even amidst the demands of a rigorous curriculum, you make time to serve the local Chicago community, uplifting those in need, showing the true heart of what it means to be a UIC student. One of my favorite examples is the work you do for Altus Academy, where many of you mentored local grade school students, sharing your passion for movement and healthy living, and maybe even planting the seed for the next generation of physical therapists. Our department head, Dr. Rosarino, once said, "At UIC, we're a blue-collar kind of PT program." That really stuck with me because it's true. We show up, we roll up our sleeves, put in the work, and aren't afraid to get a little sweaty while doing it. Because we know what we do really matters. And this class, you already embody that spirit. So as you step into this next chapter, I want to leave you with something that someone once told me. If this experience doesn't challenge you, it won't change you. And your clinicals will challenge you. You'll have moments of doubt, moments where things feel uncertain or overwhelming, and that's completely normal. Don't be afraid to make mistakes. Speak up and ask the questions even when your voice is shaking. That fear, that anxiety only exists because you care. Let it fuel you, not stop you. And I promise your compassion and commitment will guide you to become the extraordinary clinicians that you are all meant to be. So, as you move into clinicals, as UIC trained professionals with sharp minds, big hearts, and the grit to take on anything, I hope you go out there and spread that UIC spirit. Elevate your teams and make your mark. But most of all, impact the lives of your patients in the ways that only you can. And just know, we'll always be here. If you ever need support, a sounding board, or just someone to talk to, you know where to find us. And who knows, one day you might even find yourself back here on this side of the mic. So congratulations, class of 2026. We are so incredibly proud of you. You've earned every thread of that white coat. Put it on proudly. And now I would like to welcome up their fearless leaders, Brandon Parros and Shivani Patel.
Sorry, I was just crying for the last 10 minutes.
Another speech.
Okay. Good evening, everyone. My name is Shivani, and I'm here with my fellow class representative, Brandon. We are both so honored and excited to stand before you today on this special occasion. Thank you so much for being here to celebrate the class of 2026 as we receive our white coats today. But before we dive into our remarks, we'd like to begin by recognizing some important individuals who made tonight's ceremony possible. We would like to ask the following people to please stand: Tina, Adriana, Ashley, Rachel, Gabby, Ale, Maura, Jesse, Rocky, Vanessa, Nisha, and Christy. These individuals have worked tirelessly on every detail for tonight, including these crisp new coats, the gorgeous decorations, and the programs in your hands. Thank you for all your dedication and hard work. The event simply would not have been the same without you.
Thank you again to the White Coat Committee. All right, good afternoon. As Shivani said, my name is Brandon, and I'm the other class representative for the cohort of 2026. I'm a little bit surprised to be up here delivering a speech instead of showing off my toe socks or my hacky sack, but I am very grateful for the opportunity to speak on behalf of my classmates. So when we started PT school almost 2 years ago, I had an idea of some of the things that we would be learning about. Things like anatomy, physiology, memorizing the exact word-for-word phrasing of the APTA vision statement, things like that. However, I was surprised to learn that a big part of physical therapy education is metaphors. Therapists use metaphors all the time to explain complex ideas, such as the neuroscience behind why a patient might have low back pain. Dr. Tom, you should know that very well. In this spirit, I would like to share our own metaphor to explain how this program has pushed us and how our classmates have supported each other along the way. So here's the metaphor. PT school is like graded mobilizations. I know that the PTs in the room have heard that term before, but you don't need to be a physical therapist to understand the concept. Let me explain with the next slide. So this picture shows Maitland's grades of mobilization. This is a system that describes how therapists apply force as they push on a joint. So you have grades 1 and 2, which are lighter pressures that can help reduce pain and promote relaxation. And then you have grades 3 and 4, which are firmer pressures to increase mobility. This will all be on the test later, by the way. And then grade 5 is a quick, small thrust that can help restore motion and relieve pain when everything else has been pushed as far as it can go. This is what you see in your Facebook feed when you see people getting their backs cracked. Now, I promise I'm not turning this speech into a lecture, but this framework really mirrors how my classmates and I have moved through this program together.
Okay, grades 1 and 2. Well, that was us at the starting line. We were wide-eyed novices trying to figure out grad school and our path as future clinicians. We huddled together in the library basements for group studies and powered through all the late nights and some early mornings. A few of us even brought along a designated blanket. Gabby, you set the gold standard for comfort. Little by little, we realized that these people were not just our classmates, but ultimately these were our future colleagues and now our friends. Then came our first true test, literally. Those initial exams reminded us that this wasn't grad school anymore, or this wasn't undergrad anymore. PT demanded more. It demanded more efforts, more critical thinking, more support. And so we dug our heels in, we pressed into grades 3 and 4, and our study groups transformed from casual gatherings into structured deep dives. And whiteboards became prime real estate for origin and insertion lists, especially when Hector claimed every square inch. And at that point, we didn't just want to pass, we were determined to excel.
At this point, we didn't just study together, we needed each other. We offered feedback, we learned how to be vulnerable, and we practiced communication as much as we practiced our special tests. This was more than school, it was real professional collaboration. And then there were those grade 5 moments, times when we felt like we had done all that we could and still needed one final push. That's where our fellow classmates were invaluable. And no one exemplifies this more than our classmate JT. Before every single exam, he sent us a motivational message in all caps, reminding us to trust your gut, you got this. His encouragement and the encouragement of all of our classmates, all the faculty, our friends, and our family is what keeps us progressing to new limits. Not to mention, if you ever need your back cracked, look no further than JT. Just as we've progressed through those stages, we've also grown from newbie learners to confident students. And whether we're performing gentle mobilizations or powerful thrusts, every step forward has shaped who we are. Looking back, our class has built a tight-knit, supportive community, from late-night muscle quizzes to trying grade 5 techniques on roommates, pets, family members. Thank you again, by the way, or maybe sorry. Our journey has been full of laughter, learning, and growth.
We want to thank the people who made this all possible. To our professors and our clinical mentors, thank you for challenging us, guiding us, and for never rolling your eyes when we mixed up the medial and lateral again for the 100th time. Our collective confusion has single-handedly kept the Dunkin' and Starbucks on campus in business. To our families and friends, thank you for your patience, encouragement, and for surviving our "let me show you this manual therapy trick," and for always having ice packs on hand. And to our classmates, thank you for being each other's biggest cheerleaders, strongest teammates, and occasionally bravest test subjects for our manual therapy demonstrations. Tonight's ceremony is more than symbolic. While these white coats represent responsibility, compassion, and privilege for caring for others, we step into our clinical rotation with not just the knowledge, but the community. And that's what will truly make us great clinicians. So to the class of 2026, let's wear these coats with pride. We've earned them with hard work, perseverance, and heart. And then when the road ahead gets tough, remember, it's okay. We can always return back to a gentle grade 1 and start again. Thank you for being part of our journey and celebrating this milestone with us tonight.
And now we will begin the presentation of the candidates, led by Dr. Leo Arguelles, with the help of Dr. Thorpe assisting in coding, and Dr. McDevitt and Dr. Gauthier in tuning.
So again, I'm Dr. Leo Arguelles. I teach in the program. I'm the Director of Clinical Education. I also want to introduce Dr. Gauthier, Dr. Tom, and Dr. Thorpe, who will be helping me present with the pins in the White House today. Let's start off with our class of 2026. Christina Isa Abasi. Lindsay Ahern. Martina Ackerman. Campbell Alba. Sam Atunson. Adriana Baruch. Ashley Bravo. Rachel Brokenshire. Christina Serda. Margaret Chin. Gabriela Crespo. Taylor Cummins. Matthew Dye.
Oh yeah!
Alejandra Díaz Barahona. Frank Dizono. Kim Dunleavy. Maura Fitzgerald. Ryan Fox. Joel Granados. Chen Xiao Han.
Well, the phone is blocking me a lot.
Ali Hashem. Hector Irizarry. Dylan Drew. Kyle Jusila. Shirley Go. Dennis Lay. Melanie Lebec. Jordan Marie Leonard. Jessica Ime Lee. Charlie Lobdell. Rocky Mayer. Sophie Miller. Nicholas Malosh. Monica Mishashe. Allison Newberry. Vanessa Iram Nudakor. Nisha Pandita. Brandon Harris. Mansri Patel. Shivani Patel. Lauren Hennick. Daniel Rogowski. Derek Rojas. Ben Roll. Pavitra Salvaraj. Lily Sherman. Colin Singh. Shannon Tomlinson. Jonathan All Caps Tran. Chris Travelos. Brian Truong. Leilani Marie Bejon. Nicole Vaca. Rob Wagner. Zach Smith. Sorry, Zach, I missed you. Christy Weissel. Brian Yu. Ola Zugai. And we can have a round of applause also for our faculty that At this time, I'd like to invite Dr. Aaron Kyle for a speech.
We're getting close to snacks. That's a big deal. Do they look great or what? Let's give them a hand. What a truly special time. This is so good to see you guys. We are finally sending you out to do the thing that you've wanted to do for so long, you actually finally get to do something to help patients. It's going to happen. And congrats to that, for that. You now have the privilege to meet some of the most wonderful people you will ever meet in your lives, your patients. And a few years ago, at another one of our white coat ceremonies here at UIC, I shared a reflection I had written about one of my patients. And I'll ask my colleagues, if you were there that day, to forgive me, because I couldn't think of a better way to help really put this moment in perspective than sharing that perspective again. This is a story about one of my very first patients that still impacts me today. I can still remember what his room looked like. The curtains were always shut. He wouldn't let anyone ever open the drapes. The mood was cold, it was dark, it was depressing. Eric was in his late 30s, and he had just had a massive stroke. I was a brand new PT at the time, and I was eager to put all my hard-earned knowledge finally to good use. I knocked on the door of the hospital room, and Eric's wife welcomed me in. As I entered the room, I started my pitch. Good morning. My name's Aaron, and I'm going to be your physical therapist. And that's about as far as I got. At that point, Eric couldn't say a single clear word, but he didn't have to in order to get his point across. He flailed about in the bed, communicating in no uncertain terms that I was to get out immediately, and that he would not be working with me that day or any other day for that matter. I left the room mumbling something like, "It looks like this may not be a good time for you." But I went back the next day, and the next day, and the next day. And each time I went back, it went the same way. I'd try my best to convince Eric to work with me, and he would yell and scream, and I'd go away defeated. I just don't know why he won't even try. Doesn't he know that I can help him? And then it hit me. He probably doesn't know. Why should he know? How could he know? So I decided to try one last time, but to alter my approach with Eric. The next time I went into Eric's room, I knelt down by his bedside, and I said, "Look, I know you don't want me here, but please, just hear me out this one last time, and if after I'm done you don't want me to come back, I won't. That's it. All right?" And he just kept looking at me, but he stopped yelling. So I thought, this is my chance. "Eric," I said, "you can get better. I don't know how much exactly you can get better. I don't know how long it's going to take exactly, but I'm telling you, if you and I work together, I know I can help you, and I know you can get better. You can start to rebuild your life, and that process can begin right now, if you want it to." Now, did I know for sure that Eric was going to be independent again? Of course not. Did I know for sure just how much better he was going to get? I didn't. But what I could see very clearly that day was that Eric desperately needed hope. He was silent for a while, thinking about what I said, and finally he looked right at me and he nodded. And it was on. That first day, I helped Eric sit on the side of the bed for the very first time since he had his stroke, and he promptly passed out. In fact, Eric required total assistance for just about everything we did during the next several weeks. But slowly, through a lot of sweat and even some tears, he did start to improve. Now, Eric's main goal was to walk again by himself. That's what he wanted more than anything. And I wasn't sure that would ever happen, to be honest. But But what I told him was, if it was going to happen, he would have to give 110% every session, no matter what. And that's exactly what he did. In fact, to this day, all these years later, Eric remains one of the hardest working patients I've ever had the privilege of working with. Eric and I worked together for several weeks until he was discharged to continue therapy at another facility. And at the end of our final session, Eric made me a promise. He told me that when he could walk on his own, he would come back and show me. I shook his hand, wished him well, and said goodbye, wondering if I would ever see him again. Several months went by, and one day at work, a familiar-looking woman approached me. It was Eric's wife. She quickly told me that he would be joining us soon. And a few moments later, Eric came around the corner, pushing himself in a wheelchair. And I'll admit, it was great to see him, but I was a little disappointed that he was in the wheelchair. I had hoped that maybe he'd be walking at least a little by then, and that he had come back to show me. As I walked toward him to say hello, he held up his hand. He was smiling, grinning, kind of like he knew something I didn't know. Eric then locked the brakes on his wheelchair and he stood up and he walked towards me on his own, just as he had promised me. Eric had defied the odds and he met his goal. When he reached me, we hugged each other, and then he said he had something for me. He had a gift. And this is what he gave me. And I hold on to it today. It's a small piece of pure silver, and on it the simple words, "Thank you." In the many years since that amazing moment, my career has seen the share of its highs and lows. But through all of the peaks and valleys, one thing has remained constant. I still have the absolute privilege of helping wonderful people. People like Eric. People who have taught me so many lessons about grit, and determination, and resilience, and to never, ever give up. And for those lessons, I will always be so very grateful. So Eric, thank you. You have all now earned the right to meet and to help people like Eric. The oath you're about to take signifies this privilege. You guys ready? I'm going to ask for the class of 2026 to please stand. All right, we're going to go slow with this. I want you to think about what you're saying. These are not just words. This is an oath. Please raise your right hand and repeat after me. In the presence of my colleagues, friends, family, and teachers, and in view of the honored profession I am entering into, I solemnly pledge I will practice physical therapy with compassion, preserving the dignity and well-being of my patients.
I will practice physical therapy with compassion, preserving the dignity and well-being of my patients.
I will respect the lives and choices of my patients.
I will respect the lives and choices of my patients.
Safeguarding the trust and confidentiality of our relationship.
Safeguarding the trust and confidentiality of our relationship.
I will remain humble.
I will remain humble.
Recognize my limitations.
Recognize my limitations.
And seek collaboration and continued education to improve my care.
And seek collaboration and continued education to improve my care.
I will share my knowledge with colleagues and patients openly and patiently.
I will share my knowledge with colleagues and patients openly and patiently.
I will strive to enhance the quality of life for all my patients.
I will strive to enhance the quality of life for all my patients.
I will do no harm and uphold ethical, fair, and just practices.
I will do no harm and uphold ethical, fair, and just practices.
I will not allow my judgment to be influenced by race, creed, religion, greed, or unethical behavior.
I will not allow my judgment to be influenced by race, creed, religion, greed, or unethical behavior.
I will commit to advancing the profession, ensuring all who seek care receive proper and ethical treatment.
I will commit to advancing the profession, ensuring all who seek care receive proper and ethical treatment.
With this oath, I embrace the responsibilities and rewards of this profession.
With this oath, I embrace the responsibilities and rewards of this profession.
Way to go, let's give him a hand. We are so proud of you all. That concludes the formality of our ceremony. I'm going to have everyone stay seated except for you guys. You all get to come up on the stage and take a picture.